Hello, I'm Dr. Russell Libby, and I welcome you to the world of medicine. You know, we've done a few shows on obesity, but it's been adults, and certainly it's a big issue. My God, it's become epidemic in our country, and not just our country, but all over the world. We have a population that's become overweight. And in those shows, we explored, well, a lot of the issues, but some of the major issues were the medical complications and the expenses that they incur that come with obesity and people being overweight. We spend somewhere close to $300 billion a year in this country to take care of the medical costs and the lost productivity of people who are significantly overweight. But what we haven't explored is really where it comes from. It would seem pretty natural that it should be from, well, from childhood. And today we're going to explore some of those issues about children and excess weight and kids who become significantly overweight and obese. What is the message we communicate in our culture? How is it that people want to eat the way they do? And how do they understand the foods that they're eating and the ways they fit into their diet and they can stay healthy? Well, we're going to try to explore that with some of our audience today. We have some really wonderful specialists who know a lot about nutrition and treating obesity. We have Dr. Barry Greene. He's a bariatric surgeon. Done a show with Dr. Greene before. Bariatric surgery is the kind of surgery that people do to help lose weight. When they get beyond effective dieting, they may get lap banding, they may get gastric bypass. You've heard of those procedures. We'll learn a little bit about that later in the show. Dr. Chung is a pediatrician. She's a pediatrician who has offices here in Fairfax by Inova Fair Oaks Hospital and out further out 28. And she basically has gotten very much involved in pediatric obesity and has worked on a program called C.H.A.N.G.E. She does that in her office, and it's very interesting, very dynamic, very novel. We have Dr. Wali Gauvin. He is a pediatric cardiologist. You think cardiology strictly for those little hearts. Well, they are for those little hearts, but his interest is in preventive cardiology and also obesity. And he's been working with the C.H.A.N.G.E. program and other opportunities that might come his way that help him with what he can do for our community of kids. Because we have a lot of issues relative to weight. And Dr. Chung, just to sort of get us oriented, really, we know that we have, what, 2/3 of our adult population is significantly overweight, about 1/3 are even considered obese. How does that equate to what we see in kids? Do we have much of a problem?
Sure. So 1 in 5 children are either overweight or obese in our country. And that is more than any other disease that's out there right now. And when you look at that, it's such a large population that it really, when you look at these children, we know that children who are overweight and obese become adults who are overweight and obese. So it really leads to this ongoing problem that's going to continue unless we make some sort of intervention. And there are lots of different ways of going about it. A lot of it really starts, or most of it starts at home, and we talk about that in our program. We talk about different ways to encourage exercise, look at healthy ways to eat, and also deal with the emotional issues that come with being overweight.
So you're saying 20% are obese, and when we say obese, it means something to us. And it might mean something to everybody else, but boy, it sure is hard to define because we also hear that somewhere close to 2/3 are overweight. Right. And it seems that we sort of become acclimated to looking at people who are bigger than they used to. When you look at old movies, and you'd look at kids in the movies, you'd see them, they were pretty thin. And that was what your standard of normal was. I'd say you look at a lot of what we see in our culture now, and that norm has taken a different change. So we're talking about overweight versus obese. How do we define those things in pediatrics?
So when you look at, many of you who have been to your pediatrician, you know when you go there, they weigh your children, they measure how tall they are, where there's a way to calculate something called body mass index. And when you do that, it's a calculation that looks at the weight compared to the children's height. And there's a standard where we've determined what is healthy. And if you're above that healthy norm, that's when you're considered overweight or obese. We've also found that if your kids are in that range, that then they're more likely to have certain diseases like high blood pressure, high cholesterol, diabetes as they get older, even when they're young teenagers, not even until they're adults. You know, diseases that we used to think about of people getting when they're in their 50s and 60s, now they're getting in their 20s or teens, and that's really disturbing. So when you look at what we can do, there's a lot we can do early on, and that's really the goal here, is to look at ways that people can help their children early on to improve weight. And a lot of people, you know, will come and say their child is big boned, you know, our whole family's big boned. Well, there's big boned, and then there's unhealthy big boned. So really looking at the numbers, you know, the body mass index isn't necessarily a perfect measurement, but it's a measurement, and it's a starting place. It's a place to start looking at where you might need to do something to help your child. And so really using that just as one measurement. There are other studies looking at different ways to look at waist measurement, hip measurement, that sort of thing. So I think there's still more to come on ways to identify whether or not a child is overweight. But for now, body mass index is what most pediatricians will use.
Right. And they have charts in their offices that they usually keep with the patient chart. And most electronic medical record systems now will actually compute it, so you don't even have to sit there and try to figure it out. It'll put it on the growth chart according to your age, and then you can really have a pretty accurate assessment. And people will argue, well, it's not accurate. What if I'm more densely muscular and I weigh a little bit more? My BMI might not be quite accurate. The fact is that you're mincing words. You're really not trying to get to the heart of the matter, which is that weight is an issue that evolves through a lifetime. Sure. And as you let it evolve more and more, it becomes a real detriment and often will shorten your lifetime.
Very much so.
We have a great member of the audience here who, well, I guess you were a big kid.
I was very fat.
And you were very fat. Well, that's pretty blunt. That's good. I'm glad you can be straightforward about it. That's great. At what point in your life did you sort of become aware of the fact that you were probably carrying too much weight?
Well, there are several moments that I've realized that I was a real big kid. Of course, there was the amusement park moment when everyone goes to the amusement park and it's like, let's go on a roller coaster. And I went to get on the roller coaster, and apparently someone had big hips and was not allowed on the roller coaster. So I got in line and I got up to the roller coaster and I was like, I'm gonna fit on this roller coaster today. And I went to go sit on it, and I wasn't getting on the roller coaster that day.
So it used to be, at first, you had to be above a certain height.
Which is already difficult for me.
Now you have to fit in the seat, and that was a problem. How much did you weigh at that time?
250.
250, how old were you?
14.
14. And at the highest weight, how big were you?
About 300.
300 pounds, and that was at age?
16.
16. So you probably spent a few years thinking about it, wondering what you could do about it. Are there people in your family who are overweight?
Well, I come from a family that loves food. Every holiday we have is and so, you know, birthday parties, it's like, let's go bowling, let's go, to the movies. For our birthday parties, it's like, let's go to the buffet.
Right.
So, so oftentimes I found myself indulging in food. And also we all, every person in that world, you have to walk through that valley, in different times. And, when you walk through the valley, you get hungry while walking through that valley. Yeah. So sometimes you reach in the freezer, it's like, Ben & Jerry's, how are you today? And sometimes they're doing very well, and you just want to eat all the Ben & Jerry's.
Yeah. I guess they're personable, but sometimes they can lead to undesirable
They
outcomes.
can.
So you bring up a couple of interesting issues. So you're basically indirectly saying that your family was very focused on food, and probably from the time that you were little, as unconscious as you might have been, you were being oriented towards thinking about food as that ultimate reward. When you had fun things to go on, when things got sad around the house, was food where you turned?
Oh, yes. Food. I jumped on the food. I love food. And I found that no matter what was going on through life, no matter what, if I got a bad grade, if I broke my big toe, any detrimental thing that would happen, I would love food. It was there for me.
Great. And food is still there for you, but you found a way to at least not look it in the eye anymore.
Oh, I did. I did.
You look it in the eye, and then you walk away.
Well, sometimes. Sometimes I skip away. Sometimes I do a slow walk.
Okay, right. Well, I think skipping away is the way we want to go, because we want you to get a little aerobic activity
Yes.
doing that as well. We'll talk about that too. But Dr. Chung, so we're hearing some interesting things.
Yeah.
You know, people certainly have risk factors for being overweight.
Sure.
And he described two pretty much. One was, it seems like there's a fairly significant genetic component, but that environmental component. But when we think about babies and people being overweight from day one,
Yeah.
is there something, is pregnancy a risk period for having kids who might be overweight?
So there's a lot of studies out there now looking at obesity and whether or not you can predict whether or not somebody is more prone to being obese, looking at genetic predispositions to that. Is it something that runs in families? And we do find that there's obviously, you know, people talk about their metabolism being slow or fast, and there are cases where you can tell, you know, you have two kids, one can eat everything and is just thin as a rail, and the other kid can just look at a piece of cake and get fat, you know. So there's clearly some difference in the way a person's body metabolizes food. At the end of the day, it tends to be, though, if you take more calories in than you burn, then it's going to become weight. You know, that's just really what happens. If you eat more than you use, it's going to become weight. If you eat an extra 100 calories a day, that's 10 pounds of weight a year. You know, so just 100 calories, that's not a lot.
100 calories,
Yeah.
that's less than a can of soda or juice.
Oh, much less, yeah. So it doesn't take much to gain weight. So you really need to burn up what you eat and what you use.
Right,
So
and
what you take
those
in.
are interesting concepts too. Dr. Gauvin, are there certain medical conditions that may predispose people to gaining weight?
There are, but they're very rare.
Okay.
You know, and granted, obesity is multifactorial, but when we look at some leptin deficiencies or some genetic chromosomal abnormalities such as Prader-Willi, those are
Right.
a very small number of people in the world. You know, and so a lot of it is, you know, primarily environment, genetics, and on a day-to-day basis in terms of what we're exposed to at home as well as in our daily lives.
People always try to say, oh, my thyroid, I must be hypothyroid, that's got to be it. And probably you're sort of forced at least to placate people by checking their thyroid levels.
Sure. I keep
But how
checking
often do
mine.
we see obesity in kids secondary to hypothyroidism?
It's probably less than 5%,
Yeah.
you know, so it's a very small number, very small number. And though we do check, I have not seen anybody who has obesity and hypothyroidism.
Right.
Yeah,
So
so
even
I
if
mean-
they are a little hypothyroid,
Right.
that's not why they're obese.
That's not why they're obese,
Right.
that's correct.
More of the time, if you screened everybody, you'd find that they're thin and they're not so thin, and all
Exactly.
kinds of different people with marginally low levels. And so we, as opposed to some of those situations, as adults get older, they may have more debilitating kinds of problems. They may carry a lot more psychological burdens with them, and they may turn to food. Kids are generally fairly well oriented to food by virtue of that whole environment that they grow up in, as you're saying. And it's very enlightening. Now, you're a dietitian, and you probably have, oh no, you're a physical therapist, right?
Exercise
You're
physiologist.
exercise physiologist. I knew it was something in that realm. But you deal with people like Andrew here who basically gain weight. And when you must have dieted a few times.
Yes. Atkins, Weight Watchers, anything that was on a TV commercial.
Yeah.
Because obviously I would sit on the I sit on the couch and watch TV all day while eating. So I was sitting there and I was like, this TV must be telling me the truth. So, but it was.
Yeah. And of course, what's the most important part of what Dr. Chung was saying is that if you don't burn up the excess calories, they're just going to add up.
Right.
And so you see people who come in with this whole environmental inclination, are most of them more sedentary?
Yes. We run a fun and snack program over at Inova and Fair Oaks, and they and we've been doing it for 5 years now. And we run and we see that the kids don't even really know the difference of sedentary and active, and they don't even know what being active is anymore. They don't go out and play. And unfortunately, the environment plays some of that, and with the working parents, it plays a big role too. And that with the environment, people are scared to let their kids go out without them home. So they don't have them go out. And with this competitive society as far as school goes too, they want them, you know, playing the piano and doing the violin and doing their homework, which of course we're not saying you shouldn't read and you shouldn't do homework, but you know, you do need to get home and you do need to be active. So we do try to say that has to be a part of your day and everything. They should go out and run. They should play tag. They should do pickup games. I mean, in our neighborhood now, they've started kick the can again. I mean, that's great. I mean, kids out there running and playing and doing things and playing pickup games is what we need in this, you know. And with our program that we have, we try to teach them healthy lifestyle.
Right. That's great. And I think that it's pretty remarkable how many people are afraid to let their kids actually be outside. Playgrounds have become places where I guess liability becomes overwhelming, and people have cushions and low kinds of things that you can climb on just so if you fall, you don't get hurt. People don't do the kinds of things that really get their hearts racing and they get good exercise. Now, you are in what grade?
6th grade.
6th grade, okay. So, do you guys get much recess at school?
Only 15 minutes a day.
15 minutes a day, is that every day?
Yes.
Yeah? And is it pretty active, or do you have not
No,
much
not really.
time to get that kind of active in 15 minutes? You got to get to the PE, and then you've got to get oriented, and so you get 5 minutes of actual activity?
Well, sometimes, but sometimes most of the kids like talk or something, like not really doing any exercising.
Okay. So
it's
there's
mostly
not a
just
lot of
free
push
time.
for you guys to be physically active?
No.
Right. Do you find that food on television sort of gets you excited and you want to celebrate with food?
Sometime.
Sometimes, yeah. Do you think, when you think about birthday parties, do you think about what's going to be there in terms of cake and ice cream and those kinds of things?
No, not
No?
really.
It's mostly the social thing now? Yeah. Was it ever the food thing?
No.
No? Well, that's good. You're great. That's a wonderful thing. I know that the birthday parties, all of the celebrations, they all seem to be completely committed to high-calorie foods and ways that are just sometimes unfathomable. Now, when we were talking about those risk factors, we talked about the environmental, the genetic, the lack of exercise, and some of the medical issues that aren't really that likely to be coincidental with those kinds of problems. We've got medical issues that are a result. Now, you were talking a little bit before about some of the things that happen to kids when they are overweight, and starting with those screening times, and I will want to hear a little bit about how you address that with young mothers and babies who are off the charts, so they say. But how do we look at some of the medical issues? We've got cardiovascular issues, which are obviously alluded to. In terms of heart disease, when do we start to see real coronary artery disease start?
So actually there are a lot of studies now which show that adolescents or even children begin to develop fibrous plaques in their coronary arteries at a very young age now. And so, you know, being that this is the age of prevention, we're checking the cholesterol at a lot younger age. The American Academy of Pediatrics recommends getting a fasting cholesterol at the age of 2.
At the age of 2.
Yeah.
So people that are overweight are going to be more inclined to have some alteration in their lipids, in their blood fats, that will make them more predisposed to getting this cholesterol deposition, the plaque formation.
That's correct.
And that's what ends up leading to heart disease as they get older.
Yes.
And ultimately to early cardiac problems.
Yeah, certainly you can actually, there are a lot of studies showing that you can actually develop cardiomyopathy, which is a weakness of your heart and muscle later in life, and it can actually cause sudden cardiac death as an adult, and it's secondary to obesity. You know, so a lot of what we do in cardiology is detection of what your cholesterol is, what your blood pressure is. Also looking at the mass of your heart, because what can happen over time due to the excess weight is you can have an increased thickness of your heart muscle, and that can cause dysfunction of your heart.
Wow. So we have cardiomyopathies, you have early plaque deposition, and this is primarily, obviously there's a genetic element if you have a lot of heart disease in your family, but if you're significantly overweight, we're going to see these kinds of things. When you screen kids who are overweight in the preschool and school age and adolescent age, do you see higher cholesterols than normal in those who are overweight?
Sure. Sure. And so as young as 2, we'll see cholesterols. They're 210, 220, and it's 170 is normal for a young child. And these are children who are a little overweight, you know, not necessarily the ones that are grossly obese or very, very overweight. And so it's amazing to find out how young this can start to affect a child and his body. And the other piece of this for children is the social issue. You know, when you look at weight, you know, obviously socially that's a big issue. When children start to realize that other kids are different, you know, and that can be a big problem. And so, sort of avoiding that issue. So, preventing obesity has many levels of benefits, psychologically, health-wise, physically, you know. So. One thing we were talking about with young infants, and there have been some studies looking at early introduction of solid food and whether or not that leads to obesity later on. And so there's some theories that by introducing solids too early at 4 months of age, which is reasonable, may lead to obesity later on. And so there are many studies looking now at how early can you intervene and make a difference, especially if you know in your family that there may be a history of obesity.
So, and then of course breastfeeding is supposed to be protective,
supposed to help. That's
and to some extent, although some of those babies really
big,
grow
so, yes.
huge, and you just can't believe that that's all they're feeding them, and you wonder really if that is all they're feeding them. But nonetheless, they can grow really tremendous.
And I think culturally, there's a lot of issues when you look at different cultures. You know, I grew up in a Chinese culture where the larger you were, the richer you are. You know, in China, if you can feed a baby a lot, then you must be very well off. So my parents' philosophy was, if you were a big kid, then we're doing great, you know. And so, and I think a lot of ethnicities that's the case, and there's just very differing opinions on what's overweight and what's just healthy.
Yeah, and in this area we do see a remarkable diversity in ethnic backgrounds, and many of them come with grandma, who has a very specific attitude about how you should raise your child, and many of them do come from this culture where eating and being large and I guess robust reflects a good socioeconomic and healthy family unit. And there is a lot of stress placed upon these families. And they really have a hard time because a lot of times kids don't want to eat and they actually resist eating when you're pushing them to eat. And we see a lot of very confusing situations. But we have then pregnancy where you have women who are diabetic. Gestational diabetes can predispose you to having a bigger baby, and bigger babies tend to be bigger young children and bigger adults.
That's right.
You're saying that sometimes formula-fed babies may be at risk, introducing solids at an early time. And then there is the family issues, and I know that you're fairly cautious about how you've communicated the importance of food and snack foods and reward foods with your kids.
I'm only 5'1", so all through my life I have known about that 100 extra calories and the difference it could make. So what's been very important to me is to raise my children with the knowledge, the best knowledge that I have. And when it comes to food, I work with them as far as understanding what makes up a healthy meal. And we have dessert some of the time, and we have a treat some of the time. But and they eat salad, they eat vegetables. People are amazed at the wonderful array of foods that my children eat. And I'm so proud of Sarah and her brother, Chip.
Yeah, Sarah, you got to tell me, did she teach you from the moment you can remember that you got to eat a few vegetables and fruits every day?
Yes.
Yes. And is that okay by you?
Yes.
So you're pretty, well, you try different foods. You're pretty adventurous when it comes to eating meals?
Well, most of the time.
Most of the time, yeah. I bet there's some things you like more than others.
Yeah.
When you think about a snack, what are the kinds of snacks that you like to think about?
Well,
you can be honest. It's okay.
I like to think about, like, crackers that are whole grain and, like, cheese sticks and stuff like that.
That's good. So you're not one who's thinking about chips and eating lots of cookies and that sort of thing. Well, that's really good. And do you like to stay physically active too?
Yes.
Do you have sports that you play?
Yes.
What do you like to play?
Tennis.
Tennis, great. Do you swim too?
I do synchronized swimming.
Oh, synchronized swimming. Oh, that's unique. That's pretty neat. That's great. So your kids, they get the orientation they need.
So you can see it works well at our home. But my challenge is all these well-intentioned, loving coaches, teachers, bank tellers, and adults who are constantly offering my children candy and junk food. Sometimes many times it's 3 times a day. You know, they'll go to Sunday school and be given a cookie, and then they'll go to choir and they'll be given another cookie, and then they go to swimming and they're given candy, and they go to tennis and they're given candy, and it's like, whoa, you know, I sent my child to you to learn how to, you know, play the piano, not to be given a cookie. Or I get in battles with the camps, and you know, please ask the camp counselor to not give my child food. It's only an hour and a half, and it's right before lunch. They get out at 12:15, and she was given a huge cookie. It's like, if she eats that cookie, she's not going to eat a healthy meal. So I would love to see a culture change where people know that they can express their love for children, because that's what they're doing. They're showing their love through these gifts of food. And that it's enough just to teach my child tennis or to teach them music. But if you really want to give something extra, so you're the favorite coach, a sticker is nice, or a pencil. And my other child has food allergies, so a lot of times, you know, he's left out. Right. And I went into a music class where my children were, and I was horrified to find the music teacher was giving out Reese's peanut butter cups, which would have made my son very, very, very sick.
So it is ubiquitous in the culture. Certainly any store, convenience or otherwise, you go into a hardware store and there are candy bars and cookies sitting by the cash register, hoping to capitalize on your moment of need and allowing you to then grab something that no one will know and you can sneak out and enjoy it. But listen, we all have those devilish treats that we need to satisfy ourselves with. When we look at some of the options, when we think about when we encounter families coming into an office, and I really want to just get a flavor, or let our audience sort of get a flavor as to the kinds of questions you ask about their kids' diets and how you try to orient them to be a little bit more healthful in the way they think and operate.
Sure. So we do this in a couple of different ways. So one of which is during just your regular office visit and your well check, or if you're just there for a sick visit and a parent brings it up. We also have our program called the C.H.A.N.G.E program that you alluded to. It's Children with Health, Activity, Nutrition, and Good Emotions. That's what it stands for. And with that program, the families meet with a nutritionist, a physical therapist, a psychologist, a doctor or a nurse practitioner, and they meet with all these different people, because when you look at weight loss and you look at that, you have to address all those issues. For nutrition specifically, we talk about, you know, how many servings of fruits and vegetables your child eats, how many servings of whole grains your child gets. Do you get enough milk? Is it fat-free milk if you are drinking milk? And looking at a lot of the simple carbohydrates that you're taking in, I think what a lot of people don't realize is how much they're drinking. Is a lot of what the calories that children are getting. So Gatorade, for example, you know, has a lot of sugar in it. Juice has a lot of sugar in it. You know, some juice limit it to 4 ounces. You know, when you look at a 20-ounce bottle of Coke, that has 36 cubes of sugar in it. You know, so if you think about drinking 1 bottle of Coke and trying to eat 36 sugar cubes, how hard would that be? Because that's what you're doing when you drink that bottle of Coke. And so we just don't realize it because it tastes good and you're just sucking it down, so who knew, you know? So you add that into what you're eating, you know, and so it's very, very easy to eat way more than you think you are eating, and taking in more calories than you're going to burn, and that's what leads to that weight gain. So a lot of it is going into, you know, the meals, the snacks, what they're getting at school, because, you know, every week there's a birthday party, you know, so somebody's having a birthday, so somebody is bringing in cupcakes or donuts. A lot of schools around the country are making changes so that for birthdays you can't bring food for snacks, and that's a positive movement, you know. So bring pencils and bring prizes and other goodie bags, but not candy and not food.
Right.
So that's a good thing.
That is great, and it's interesting when you talk about the fact that people really don't pay much attention. They often give snacks not only to reward, but also to, let's say, divert. When there's some place where they don't want the kid to be annoying, they'll give them something to snack on, something, of course, that is so calorically dense and so rewarding that the kid will be quiet and sit there and munch away. And of course, that reinforces some psychological reward for really aberrant behavior anyway, because that's why they were given that in the first place. Right. They weren't patient, they weren't, let's say, cooperating with the moment. And the fluids, really incredible. When you think about, you could have a bottle of water and you could have those 15 or 20 cubes of sugar. And you can't even imagine sitting there and drinking the water and then, you know, popping those sugar cubes. I guess some people could, but boy, that would be hard to imagine. But when you drink a large, you know, beverage, a soda, a cranberry juice, which is even more remarkable relative to what they have to use to make that sweet because it's so sour in the first place. There are so many foods that people just gravitate towards just because they're so calorically dense. Now, one that is amazing to me is milk. And when we look at kids and the fact that they love their milk, and then families are used to whole milk. Do you recommend whole milk at any age?
Well, you know, up until usually age 2, but then we will quickly change over to then a low-fat or a skim milk. But you'll see, I think, kids continue to, you know, if it was used initially, again, in a pacifying sense or as a comfort sense. I think we build these comfort things very early on. And along with the juice and other sources, you know, just a lot of liquid calories, whereas I try to work with people on, well, if you know, you want to have 8 to 12 ounces of juice, which could be, you know, up to 200 calories, why not actually have the piece of fruit for 60? You know, and so other options, and really trying to look at, we don't get the satiety from the liquids, even the milk. I think a lot of people see it as just this great healthy thing, and I think we have a lot of health halos. If a little bit's good, then a lot must be better. And so we really have to kind of step away from that and looking at, the things that are actually satisfying for us.
And I'm focusing on milk. It's incredible to me just because, well, if you like 2 cups of milk a day, the difference between skim and whole milk, if you have 2 cups a day for a year, is what, 14 pounds of butter.
Could really add up, it really can.
I mean, that's the difference. So you can have skim milk and you can have your butter along with your sugar cubes sitting there, right?
Yes, and then have our extra weight gain every year, starting from a very young age. Right. So, and the difference, I think sometimes it goes back years to where, well, skim milk, that's just, I've heard this so many times, that's just flavored water, right. You know, right. But you really do get a great reduction in calories. So if you have to have it, why not?
And even if you go to a 0.5%, I mean, if you need that little bit of fat to give it that,
yes.
And we do know that it facilitates our taste buds and it makes things seem to taste a little bit better, but still, people get used to it and they can find that it's thirst quenching. And chocolate milk, which seems to be what has been trended in significantly. Yes.
Is let's add something to it to add more calories. Yes. And we tend to do that a lot, you know. And some of the cooking shows out there, you know, take the corn and dip it in butter. So I think we add a lot of things that we could step away from and enjoy just the natural flavor, which would be good.
Yeah, and it is amazing because with chocolate milk, you're not only adding the sugar, you're adding more fat.
Exactly.
And things like Thanksgiving where people deep fry turkeys. Why do they need to do that?
Or everything, or vegetables,
Right.
you know.
Sure.
Even, and growing up in the South, it was hard for me to distinguish that, you know, if it wasn't fried, a lot of the times it wasn't good. And so I think learning change behavior in our lifestyles is important, that, you know, other things can taste good. And then non-food rewards, very, very important. To really start implementing with our kids, just not food related, and as adults too.
Yeah, and it's really a hard pattern to stop. I think that people get so psychologically just prepared for that. That is the ultimate easy reward. Easier than saying I love you, easier than patting them on the back sometimes. Just give them a piece of cake or a cookie or a scoop of ice cream, what the heck? Makes you feel good, I'm loved.
But it can be detrimental, and I think we have to start shifting our views of how we see love and affection, especially with our kids. And it can be, you know, let's go, you know, get that sit and spin that we can spin around on and be active, and instead of the chocolate cake.
So, and you're our dietitian.
Yes. And
when you work with these families, because you can't just deal with most of the children as they come in. And the C.H.A.N.G.E program has 2 different age groups.
That's right. So ages 6 to 10 and 11 to 18, and it's the parents and the children together.
So that's 6 to 10, you got to do some pretty intense
some fun activities.
Parent work, yes. And when you do a diet history, what do you look at? Is that how you initially do this? Try to get people to be aware of what they're eating and how much?
Well, I think looking at the diet history is very important for the family, for the children involved. That is, we'll take one of my favorite things to do, which my patients they know me well for, is get people to what we call self-monitor. Before you come to the visit, keep a log. Don't necessarily try to make any big changes. Just give me a couple days of what you usually do. So then that way we can use that as a starting point. And I recommend that to everyone who's thinking about making changes is let's just start writing down what we eat for a while. Gives you more of a recognition. So that's a good starting point, I think, just to start monitoring ourselves and the foods that we put in our mouths.
Well, I know when we ask people how much they drink, we usually add 20% on. I would imagine that probably you got to do the same thing for food, right?
People traditionally will underestimate upwards. They've seen some studies upwards of 30 to 40%. They underestimate their calories.
Of course, yeah.
They underestimate. If you give them a plate of food from a restaurant, drastically underestimate what they think is on the plate. And then, of course, it in turns to what we're feeding our kids.
Right.
And just recently, some restaurants are getting better about maybe putting some numbers by the food items, but it's something that we have to really pay attention to and effort for.
And we hear about food pyramids and all these different feeding charts, and it says a serving of, and of course, to me, a serving might be this big. To you, it might be that big.
Exactly.
But help us understand, what do they mean when they say one serving?
The servings, traditionally they were based on, the diabetic exchanges and things, and when we teach the USDA actually, .gov, they have a ton of stuff on the USDA websites for adults and for children that will explain some of these things. The fact that, yes, a serving of grains, which we hope are whole grains with fiber, but a third of a cup.
A third of a cup.
And most restaurants, what do we get? We get maybe 2 to 3 cups.
Easily.
Yes. And then for beverages like juice, for example, some juices, an actual serving of certain juices is only supposed to be a fourth of a cup.
Right.
That's a few tablespoons.
Right.
So I think that awareness is important, and there are now some more resources, kidseatright.org. There's several places online we can go and start learning and educating ourselves, and then help educate our children, which would be great.
That's amazing. I mean, really, when you think about serving sizes and what they're basing what is a normal serving versus what the reality of what most people get served, and fast foods, they completely distort any reality relative to serving size,
They
nutrition.
make my job very tough. No doubt about that, especially when, and you've seen the comparisons in some of what it looked like 20 years ago, what it looks like now, the biggie size, the great size, and where we can take what a meal used to be, maybe a couple hundred calories, and now go to 1,200. And even some restaurants are proud of their 1,400 calorie, what have you.
Right.
And it's frightening because most of us, what we may need in a day, we get in a meal.
Or the Coronary Cafe, or I don't even want to talk about that one, but we've seen that on Sunday morning. Boy, it's a scary place, but people love it. Nonetheless, though, we're looking at, well, the average, let's say, school-age child has about what number of calories required per day?
You know, if they're very active, I mean, you could look in the realm of 2,000 to 2,500 maybe for a very, very active child, but
well, that would be an older adolescent.
But an older adolescent.
Yeah.
For a younger child, maybe around, you know, the 1,500-1,600 marker, as far as, if you're looking at in the ages.
And when you talk about activity, when you're talking about, you know, doing
my heart broke when I heard 15 minutes.
Yes.
You know, in my day, we were out for an hour at least or more every day, and we yearned for outside time. So that really broke my heart, because we need that activity, daily activity.
And still, when we talk about some of these foods, and you're talking about, so 1,500 calories a day for a 10-year-old, which is an active 10-year-old. They go to Burger King, they get a double Whopper. That's 750. That's 750 calories alone. The fries are another 400
to
500 calories. And if they get a Coke, well, there they go. That's it.
And then the rest of the day, we're in weight gain.
Right. And everything else just adds on. It just doesn't go away. It's pretty amazing, isn't it?
So, a little frightening.
Hard to imagine. So we've got a lot to do out there, educating people. And it's funny that McDonald's used to be the worst, but I think they've tried the best of all of them to try to minimize that, at least to find foods that aren't as calorically dense. But all the fast food tends to be eaten fast, on the fly, to fulfill a crave. And they're all calorically dense and can create some pretty significant issues for you. So how do we deal with trying to get people to stop eating fast food? It seems like we live in a pretty difficult society to be able to get anything like that accomplished.
Basically, when you look at our world, it's a quick world. You know, we've more and more moved to, I need instant everything. You know, I have this many minutes between going from this place to that place. And when you look at where our kids can exercise now, it tends to be organized sports. So you have a few minutes from when they get off the bus to get their homework done, to get to practice, to do this. So the meal doesn't really fall in that world anywhere. And so really trying to find food that's quick that you can eat in the car, you know, is the question. How do you do that? And it does require some planning, you know, and a lot of that is being motivated as a parent, knowing that you're responsible for what you feed your child. Because at this age, at this young age, you can control what your children are eating, but when they get older, they're going to make those decisions. So teaching them early on that, you know, eating healthy, we can make this, we can pack it in a Tupperware box and eat it in the car, you know, and make it ourselves. And if you can't, then when you're looking at prepackaged foods, trying to find the healthiest version of that, looking for the lower fat items, the lower cholesterol items, you know, looking for things that it's better than McDonald's or better than fast food. Or if you're going to go to McDonald's, get the grilled chicken or get the salad. You know, it's not as much fun, perhaps, but it is healthier and you'll live longer. and your child will live longer, and your child won't have diabetes, your child won't have high blood pressure, your child won't have all those problems that come with that. So. And
as Lorraine has told us, you can be a good model for your kids. Certainly when you grow up thinking that French fries and ketchup are absolute heaven,
yeah, sure.
And that anything as a vehicle for ketchup has to be the #1 food in the world. You know, it's hard not to express that grand pleasure, because you certainly don't discharge it growing up. I mean, many of us will decide at some point, yep, you got to be healthy, you got to eat healthy, and you become someone who's a little bit more capable of doing those things. I do want to know a little bit more about how you get started, well, with some of the physical therapy things that you do.
Well, with the C.H.A.N.G.E program.
With the C.H.A.N.G.E program,
on the first night, we evaluate. So I'll do a full physical therapy evaluation just to make sure there's nothing wrong, no pain, or you know, that they have no functional limitations, things like that that might hinder them from doing the normal things that other kids their age do. Once we know all that, we just encourage activity. Leave out the word exercise because that's got a stigma to it, and we just teach them how they can be active. The biggest thing is going outside, of course. Kids love to be outside. So we just tell them all the variety of things that they can do. And I teach them bike safety because it's a big thing that kids love to do outside. So I also teach that in our classes. But one thing is parents say, well, it's raining or it's wintertime and we can't get outside, we can't do things. So I try to teach them things that they can do inside, like just turn on the radio and act silly to the music and dance. Or create a room that just has things that they can do. Put a mattress on the floor and jump up and down on it. Buy a trampoline. They sell these tunnels and tents for young kids, like 2-3-year-olds can use, and just get them to be very, very active. Mm-hmm. And the biggest thing is being a role model. So if you're sitting on the couch and you tell your kids, go on, be active, they're not going to do it. You have to be a role model. So if you go for a walk as a family, then they're going to want to go for the, they want to do that stuff anyway. So just being an advocate for your child, encouraging, doing it for yourself, everybody will be healthier.
There are some pretty neat new technological things like the Wii.
Yes.
Some of these video game sequences now that you can you get exercise doing those things?
You can. I mean, in our program, we do 6 weeks. So then with the active part of the first part of the first half hour is with the dietitian, and it's the kids and the parents together, because ours is the family approach. And then the kids then come into the exercise room and they into a big gym. And so one week we do we do obstacle courses, another week we do different sports, and then we bring in the Dance Revolution, Wii, Zavix boxing, and we try to show them that even though it's winter, raining, indoors, your parents are telling you can't go outside, you can still be active. And so those are the fun things. And just now they've come out with like the Just Dance and stuff. And so when you do that, I mean, they really do break up a sweat and everything, and break out in a big sweat and everything. And it's like, great. So being active is going to be something that we're trying to get them to do. Each week we try to give them homework of walking with their family, like she was saying. If you're doing it as a family approach, okay, eating dinner together, walking with the family, those kind of things are going to be very important to your lifestyle, and that's what you want to do. You don't want to use the word diet. You don't want to use the word exercise. You want to use the word healthy lifestyle. Okay, you see skinny people out there walking all the time. Okay, why can't everybody do that? Go out and walk, take hikes. Look what goes on. I mean, we live in the nation's capital here. This is amazing. You can walk the monuments. You can go to Great Falls National Park. You can go to Bull Run. All these things that we take for granted that are sitting here that probably half of us haven't been to. But if you take your family to these and go on hikes and do these things, you don't have to make it exercise. Make it a family change and make it a family approach as far as trying to make your family more active.
Yeah. And in fact, I guess if you take the metro and you walk the steps instead of taking the escalator,
exactly.
That could be half the exercise for the day. There's all this sort of brings to mind in our county, which is the wealthiest and most upwardly mobile county in the country, practically, at least between this and Loudoun from year to year. But we have a school system that actually can have kids there for 2 meals a day. There are many kids who are getting breakfast and lunch at school. And also can get their exercise if they really can't get out to do it. Now, I know that our government did pass some law this year that allows school systems to get more aggressive with healthy foods, so that now we have some options for making sure they're lower in calories, lower in sodium, lower in fat, trans fats, all those kinds of things. And we have yet to really see that implemented, but we know that that's there. We also had last year a bill that had gone through the legislature that actually would have required that the schools provide 150 minutes. That is merely 30 minutes a day, not 15 minutes a day, of active physical exercise. Right. And actually it was vetoed by our governor.
That's right.
And why? Because the Fairfax County school system advocated for that veto, saying it would cost them too much money and they wouldn't have enough time for the kids to do art and foreign languages. Right. Something's wrong here. Mm-hmm. This is the place where they're supposed to be learning how to take care of themselves and to live healthy lives.
Right.
Amazing. So you were telling me a little bit about diets, and you tried a bunch of different diets.
Mm-hmm.
Obviously, what we're talking about here is healthy living, which is great if that's what's going on around you and it's easy and accessible. But you were sitting in front of screens, television, eating.
Well, Dr. Libby, I will tell you, Dr. Libby. So the thing is, for me personally, so I agree with all the, the nutritious things that these people are saying. But honestly, like when you're a little kid, and like I can vouch for fat people across America right now. When you're little and these people are like, oh, here, eat a carrot. No, like eat a carrot. That's going to influence them, like eventually to just go out and get a Big Mac. Like they need to, I feel like all the nutritionists and all these people should make foods that taste good and are healthy for you. And I know they do make them. But like schools and stuff, like when you go to school, like you said, America's spending so much money on making school lunches healthier. But when I go to school, I get not very good food. No. So when I get that food that America's spending millions of dollars on, and I don't eat it, and it puts like a little mental image in my head that's like, Big Mac, Big Mac. Yeah. So I feel like if they would just invest that money in food that tastes good and is healthy.
Has to be creative.
Yes.
They've got a long ways to go. Well, maybe they need you there as a consultant.
Call me, yes. Obama.
So you were 300 pounds, and obviously you're not now.
Yes, on a good day.
On a good day. And you tried a bunch of different diets, and I know that your surgeon is here, Dr. Greene. Yes. And give us a little perspective on what drove you to bariatric surgery.
Well, I'm a performer, and I've been singing since like 2nd grade, and of course like dramatic things just come because family and all the fun stuff. I have a big family. So I was in theater, and of course I saw all the skinny, gorgeous people who could sing as well and also dance as well, and they were skinny and gorgeous and tall. So I was like, I have competition. So I would look at them when they were acting on stage, and I was like, what can they do that I can't do? And they were able to move around a lot easier. And when we were singing in choir or singing anywhere, I noticed that I was like, wow, they can hit those real high notes. And I was like, how did they do that? And I thought about it, and I was like, it's because I have fat surrounding my lungs. Ooh. So, yes, that might not be the medical term you all, but
no, that's
close.
That's pretty close.
The concept
that is
there.
close
Yes.
to what I was feeling in my soul. So yes, the fat was surrounding my lungs, and that fat was trying to oppress me, and it was trying to oppress my musical abilities.
Oh, great metaphor there.
Yes.
I like that. So, Dr. Greene, you are a bariatric surgeon, and you deal with people who really are at the end stage. I mean, they try to diet, and it's way beyond the perspective of their abilities.
Right, we've been talking about the younger kids and helping them to understand, but as someone gets over 50 pounds overweight, they begin to develop, as you said, diabetes, hypertension, high cholesterol, even sleep apnea, and those medical conditions change their life for the negative. Social isolation, in fact, there was a study that showed that children that were obese had more social isolation and a worse time in high school than kids that had cancer and were on chemotherapy. So it's a huge problem in our society, and while surgery is not for the person who's 20 pounds, it has been shown to be very effective on patients that are 50 to 80 pounds overweight. Now, some patients are 100 to 200 pounds overweight. But we really should think of placing this silicone band around the upper edge of the stomach in patients that are 80 pounds overweight. And I hope that in the next year the FDA will come to approve that completely.
So there are certain standards, and of course, at this point, the FDA, you have to have, I guess you're doing studies to be able to justify using these techniques on kids under 18.
Right.
But the time is coming soon where that age where you can start to do that will happen sooner.
Yes.
And what are the kinds of thresholds? At what ages do you think that that's going to happen?
Well, there have been a lot of debate about it, and Dr. Robert Sivis down in Jacksonville just is publishing a paper on over 400 patients starting at age 14. I think the society is looking at between 14 and 15 when there is both physical and psychological maturity, and a child can understand as they become a young adult what their role in their losing weight and having this tool. The patients have to see, like Mandy is a nutritionist for 6 months. They have to do exercise for 6 months. And we also have them see a psychologist for 6 months prior to having their surgery. So we know that they're ready for it.
And do they tend to come back pretty strong and pretty quickly from it, I would imagine?
Absolutely.
Let's say when you're 50 and you have gastric bypass or lap banding, you've got some pretty chronic disease processes that have evolved over that time.
Right.
Hopefully your joints are still solid. Yes. and you'll be able to exercise, right?
Sometimes.
Yeah, well, we've got a couple folks here who are going to make sure that you leave here. No, you're going to leave here with a regimen, because otherwise it's going to happen again. And it's something you have to do. You felt your chest being squeezed. Well, we want it to stay healthy. We want it to breathe free so that you can sing at the top of your lungs, and that even your neighbors won't complain, right? Okay, good. Anyway, with the bariatric surgery, you are currently then looking at kids who have right now a fairly high BMI, as you described it.
BMI 35 and above.
Right. Okay. And they are basically coming in, they're demonstrating their commitment, which takes a lot of maturity.
That's right.
They have to have a certain level of physical development so that they are safe to do these procedures on. And then you have to follow them up for quite a while. How long will you follow, let's say, Andrew here?
For the rest of his life.
For the rest of his life.
And he'll any one of the adolescent programs in the country has to be partnered with an adult program, or be an adult program that does adolescents, so that the patients can transition to an adult program and be followed for the rest of their life. The diabetes and hypertension will improve rapidly. In fact, at 2 years after surgery, 75% of the patients that are diabetics no longer are on medicine and have a normal blood sugar. So is it just because they're educated, or they're committed, or they're able to use the surgery as a tool? They're going to need education for the rest of their life, and support groups, nutrition, psych, and exercise training for the rest of their life. And all we're really trying to do is use this tool as part of their behavioral modification.
So they need society to support them too. And
Absolutely.
we need to change the way we think about food and the way we think about exercise. We certainly used to think in a very virtuous way when all these convenience foods and commercial items weren't available, and people didn't have things like computers and screens to sit in front of forever and to not do much more than shuffle their feet. But we've got to find a way to get our kids out there. I want to thank you all for watching. Certainly our audience, you're great, and our specialists, full of great information. I hope it was helpful for you. And until the next time, I'm Dr. Russell Libby, looking out for your health.